You know, it's that time of the year when everyone around you seems to be getting sick, and hospitals are starting to feel it. In Harford County, officials there are reminding people that you don't need to go to the ER for a stomach bug or for a common cold. As WMAR 2 News' Elizabeth Worthington reports, hospitals there are being overwhelmed with patients.
Waiting for like 2 hours over there.
The emergency rooms in Aberdeen and Bel Air are crowded these days, even for what's usually a busy time of year.
I would say that, we've seen about a 20 to 30% increase in our wait times.
Dr. Fermin Barrueto with Upper Chesapeake Health is seeing a lot of patients with respiratory and gastrointestinal viruses, specifically RSV and norovirus. The Harford County Director of Emergency Services put out a PSA encouraging people to call their primary care doctor or go to urgent care before rushing to the ER, unless their symptoms are severe. ER triage protocols call for the most critical cases to be treated first.
I'd say that right now we're still on the upswing. So, that's why the public service announcements are going out. I think, usually we start seeing improvements as we get into the February month. Can't come soon enough for us all, I'm sure.
In Aberdeen, Andrea Hancock's family member just went to the ER to be treated for RSV.
It was quite a wait.
How long?
I think like 3 or 4 hours just to wait to be seen, and then had to stay longer to figure out what was going on.
A crowded emergency room can also be an easy place to pick up a sickness, which does keep some people from going there until it's really necessary.
Usually if I go to the emergency room, I'll take one of those masks and put on, because I know other people are going to be sick, and I know for sure with my health issues that I don't need to pick up something worse.
I would have to have a couple of days of sickness, like coming from various orifices, to be able to go and put myself in danger, especially with all that's going on now. And so praying that doesn't happen.
Some responded to the county's PSA on social media, blaming the influx on last year's closure of Harford Memorial Hospital in Havre de Grace. With that closure came the opening of the Aberdeen Hospital and an expansion of the Bel Air Hospital.
You'd expect that kind of comment. The important thing to understand is Aberdeen Emergency Department is actually seeing just as many emergency department patients as Harford Memorial has been. With regards to overall bed capacity, which is what I think people are referring to for Harford Memorial, we did get additional beds down here at Upper Chesapeake, but we're simply overwhelming our system right now and managing through that.
Making it tougher is the fact that the hospital employees aren't immune to catching these illnesses, so a lot of days they're short-staffed.
That, for us, I would say, has probably been one of the biggest challenges.
The hospital system does want people to know, though, the ER is always there for you, and they're never going to turn away a sick patient. In Harford County, Elizabeth Worthington, WMAR 2 News.